So, welcome, my dear friends. Myself, Professor Dr. Rajendra Raghuveer Deshpande from Pune, Maharashtra State. I would like to welcome you all in this Roga Nidan lectures. Today's lecture is on 9th of October 2023. And today, I request the students to open the notebook, make an index, and as usual in the index, you please write down serial number 1. The date is 9th of October 2023. Then write down the topic, syllabus discussion, and Roga Nidan Vikriti Vijnana, paper number 1, some question discussion. This is our today's topic. Of course, in every subject of Roga Nidan, Sri Roga Prasuti Tantra, Bala Roga Kaumar Vrutya Tantra, Swastha Vrutta, and Charakuttararda, we are always following this strategy. Because first we are discussing the questions. The importance is that every student must purchase minimum one textbook of their liking as per their own language like Marathi, Hindi or English, and they always make a habit to read the index of the textbook as well. So they must be familiar with the Ayurvedic terminology and also the modern terminology. This is the first phase of the study. Whenever you study any subject, you must understand the basic definitions, basic terminology, Ayurvedic, modern. And when you hear the lecture at your college of any teacher, if you hear the lectures of Professor Deshpande, if you go on reading your textbook, always at the back of your mind, you must have the understanding of questions. And then I mentioned that you go on surfing, looking the pages from first page to the last page of your textbook. And whenever you find any question that you remember, I am also sending this PDF to you. All the question papers PDF, I am going to send you. And I request the students, they can take the printout of this PDF back to back. So maybe for each subject, you will have to spend maximum 30 rupees. Maximum 30 rupees for taking the printout. And then what next we are going to do? Whenever I teach any answer of any question, you have to make just tick mark. Okay, this question I have got the understanding from Professor Deshpande. Tick mark. Yes, this question I have understood. Likewise, we will go further and further. So today we will start the discussion about the Roga Nidan. The name of the subject is Roga Nidan Vikriti Vijnana. Roga is a disease, and Nidan, here Nidan word is a diagnosis. Yesterday when I was discussing Charaka Uttarardha, there also Nidana Panchak question was there. And I explained the meaning of Nidan is two. One is a diagnosis and second is a cause. Here, when you say the name of the subject, Roga Nidan means diagnosis of disease. Diagnosis of disease. You can write down the keywords in your notebook. Vikriti Vijnana. Vikriti is a pathology. Prakrit is a physiology. Vikrit is a pathology. Abnormal things. Normal pulse rate, what is that? 78 per minute. Normal heart rate, normal pulse rate. But whenever there is an excessive, because of the thyroid gland problem, thyrotoxicosis, there will be 130, 140 per minute pulse rate. At the rest also, not after running, at rest. That is called as a tachycardia. And that is pathology. It may be because of the thyroid gland problem, hypothyroidism. Please write down. Hyperthyroidism. All these words will come again and again. In the Roga Vijnan, in Sri Roga, in Bal Roga, everywhere these words will come. So thyrotoxicosis or the goiter, pulse rate is more. This is pathology, Vikriti Vijnana. So let us start to discuss. I will not waste much of the time. There are two papers, 100 marks each. Then paper 1, part A, Dosha Dushadi Vijnana. I have explained the word Dusha. Dusha means dhatu and mala, on which the doshas attack. And what is the definition of vyadhi? Vyadhi, disease. I request Ankit, my student, please write down some Ayurvedic terminology in a Devanagari script, Sanskrit or Marathi. So dosha, write down dosh, not D-O-S-H, dosha. Dusha, this is because typical Ayurvedic terminology. So you make some practice to write down Ayurvedic terminology in Devanagari script. Dusha. In between, you have to like sprinkling of the Ayurvedic terminology. Sprinkling. So the examiner will be happy. He knows well Ayurveda also. Dusha is a weak dhatu and weak mala, on which and the definition of vyadhi, dosha, dusha, samurchana, janito vyadhi, dosha, dusha, samurchana, janito vyadhi. Actually, dosh and dhatu, physiologically, they can be friends. Dosh and dhatu can be friend. The word, you write down the word. Ashraya, ashrayi, sambandha. Ashraya, ashrayi, sambandha. Dhatu is ashray. Dhatu is ashray. And dosha, ashrayi. Dosha, ashrayi. So this is normal relation in between dosha and dhatu. But when doshas are prakupita and they attack on the dhatus, then there is a abnormal union, abnormal pathology, that is dosha, dusha, sammurchana. So ashraya shri, physiological, sammurchana, pathological. I think you are understanding. Ashraya shri sambandha, kriya sharira. Sammurchana, roga nidan vikruti vijnan. Okay? So next, dosha vruddhi. All these are in your work, but Ashtangarude. Also there in the Kriya Sharir. Dosha Vruddhi Lakshana, Dosha Kshay Lakshana, Dosha Prakopa Lakshana. Here you can see Ashraya Ashri Bhava. That is Sambandha. Dhatu Kshaya, symptoms. Dhatu Vruddhi Lakshana. Lakshana is a symptom. Lakshana. I think one day I have explained you symptom and sign. Symptom by the patient, sign by the doctor. Remember, you remember this, must you write down all these things. Mala, mutra, purisha, sweda, mutra, urine, purisha, stool, and sweda, that is sweat. Vruddhi lakshan, kshay lakshan. So all these can be, you can learn by heart these shlokas. Okay, you can learn these shlokas. I can also send some PDF if possible. Okay, then Agni Dushti, very important. Samanya lakshan of Am. I have already explained you what is Ama. Ama is like a toxin, visha in Ayurveda, because of the faulty indigestion or because of the indigestion, because of the faulty metabolic process. Toxin, according to me, can be formed endogenous from inside and exogenous, exo from external. Bacterial toxin, viral toxin, coronavirus, streptococci, staphylococci, that also create Ama. And then you have to give the treatment Amapachaka, destroying anti-infective treatment according to Ayurveda. Okay, next. Trikatu is the best Amapachaka. Write down Suntha Maricha Pippali. Trikatu, best Amapachaka. One important herb I will tell you. Nagaramotha. Please write down. Nagaramotha. Best Amapachak. Nagaramotha. Next. Samadosha. Samavata. Lakshana. Symptoms. Niramavata. Samapitta. Niramapitta. Samakafa. Niramakafa. Samadhatu. Niramadhatu. You have to learn all these shlokas. Dosha Paka and Dhatu Paka. Dosha Paka is good. Dosh Pak is good. because we are digesting ama in the doshas, and then the doshas are pure, clean, clean, clean. So dosha pak, good. Dhatu pak, bad. Dhatu pak, bad. Why? Sir, why? Because we are destroying, because of some problem, Rasa dhatu is damaged. There is inflammation. Rakta dhatu problem, inflammation. Pak is inflammation. So for the dhatu pak, the word is bad. That is pathology. Dosha pak is a better, good. Because the patient is improving. Dosha pak. Dhatu pak, oh my God, bad. Dhatu pak, bad. So to begin with, only write down these things. Very interesting. Avarana. Next, you can see avarana. Avarana is a covering. Vata is covering to pitta. Vata is covering to cover. Covering, bad. Covering, bad. Avarana, write down. Avarana, obstruction. Avarana, obstruction. Margavarodh. Marg avarodh. Srotas is blocked. The normal channels are blocked by each other. The doshas, they cover each other. I will explain you what that covering is. Next, dosha gati and roga marg. How the disease can be spread? In the central part, digestive tract, antar marga. When related with the blood and skin, bahir marga. And when they are going to the brain, madhyama marga, very serious. So abhyantara marga, internal. Can you see my action? Bahya marga, okay, moderate. Directly on the vital organs, madhyama marga. Write down abhyantar marga, bahya marga, madhyama marga. Madhyama marga disease, danger. Prognosis, bad. Please write down prognosis. 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 In Ayurveda, sadhya, asadhya. The disease will be cured, disease will not be cured. Cancer is asadhya, incurable. Cold and cough, sadhya, curable, easily curable. Hernia, difficult to cure, but curable. So in this way, that is prognosis. All these I am talking about Roga Nidan, superficial sub-terminology. Okay. Sroto dushti and kha-vaiganya. Sroto dushti word is there and sroto vaigunya is word. Sroto vaigunya is an anatomical problem. For example, in my nose, this septum is deviated on one side, like this. That is called as a DNS. Here. DNS, deviated nasal septum. Okay, this is sroto vaigunya. Abnormality, vaigunya. And then whenever I eat ice cream, lot of mucus, lot of cough, pathological cough, lot of secretions. That is sroto dushti, pathological damage. One is anatomical structural damage, one is functional damage. Are you getting? Kha vaigunya. Kha means srotas. In Roga Nidan subject, srotas, very important. Please write down. Srotas, all the 13 srotasas. Pranavah srotas. Annavah srotas. Udakavah srotas. Important 3. Prana, Anna and Udaka. Vah srotasa. Srotasa is a channel. Then 7 dhatu. Rasa vah srotas. Rakta vah srotas. Mausa vah srotas. Medo vah srotas. Asthi vah srotas. Majja vah srotas. And Shukra vah srotas. So first 3, then 7. How many? 10. 3 remaining, 3. You know? Yes. Mutra vah srotas. Purisha vah srotas. Sved vah srotas. All 13 srotas are very important, very important, very important in Roga Nidan. You must remember Sroto Dushti Karana. Causes why these srotasas are there are important shlokas in Charaka Samhita Vimanasthan. You write down all these shlokas. Start writing immediately after my lecture. Till next Monday, you complete writing from your textbook. What you will write? 13 srotasas causes. Immediately after causes, lakshanas. Prana va srotas dushti che hetu. Prana va srotas dushti ke lakshana. Causes of pranava srutas drushti, symptoms of pranava srutas drushti. Similarly, you go for 13. So there will be 13 multiplied by 2. How many shlokas? Yes, 26 shlokas. So my kind request for all the students, Srotasa concept is very important in Roga Nidan. You must start writing the shlokas, not only shlokas, shlok meaning, shlok meaning, श्लोक आणि त्याच्या खाली त्याचा अर्थ मराठीमध्ये. What is the meaning of that shloka? What is the meaning of each word? You should know. This is homework. This is assignment. Remember, 13 srotasas, and that should be learned by heart. Learn by heart. They are very useful for lifetime. If you start Ayurvedic practice, if you want to treat some Ayurvedic way, you must know Srotasa Dushti Karana, Srotasa Dushti Lakshana, and Srotasa Dushti Chikitsa also. But that in the next year I will teach you. Okay, so these 13 Srotasas, don't forget. And Kha here, can you see the Kha? Kha, Keche, Kha is a Akash Mahabhut. That is Srotasa. That is Srotasa. Okay, so whenever you see my videos, Dr. Deshpande is seeing on the screen and always action. So that is very interesting. Then lecture is becoming. Now Vyadhi Vidyan. We want to study the diseases. Definitions, synonyms. Bija, Bija Bhag and Bija Bhag Avayava Dushti. Last line, third point. That is related with Ayurvedic genomics. Gene theory, gene and chromosome, gene and chromosome. That is there. Bija, Bija Bhag, etc. We will discuss it. So there are a lot of hereditary disorders, lot of congenital anomalies. But basically, Bija Bhag is related with hereditary problems. Like example, if the mother or grandmother has a cancer, breast cancer, the lady can get the breast cancer. There is some familial tendency. In Ayurvedic words only, gene is modern word, chromosome modern. But here, Bija and Bija Bhag. Okay, we will see that afterwards. Next. ICD, International, Classification of Diseases. International Classification. This is a modern, no Ayurvedic. International Classification of Diseases by WHO. What is that? We will going to see. Okay, next. Vyadhi Vijnana. Vijnana is a science. Vijnana, science. Vyadhi, disease. Then here, Ashtau Nindita. Ninth point, Ashtau Nindita. 8 types of the problems are very difficult to cure. So Nindita is like a bad. These diseases are little bit not good, bad. Why? There are 8. Very heighted person and very low. That is a gigantism and dwarfism. That is the problem with the, yes, growth hormone. Ati sthula, obesity. Ati krusha. I am telling you the which are 8. That I am telling you. Aloma, loma, hair, body hair, not here, hair. Loma, aloma, no hair. No, not single. Atiloma, lot of hair. These are the endocrine problems, hormonal problems. But Ayurvedic words are different. This is Ayurvedic, not modern. Ashtau Nindita. And I am telling you the relation. There may be some endocrinal problem. We will discuss it. Okay. Vyadhi Kshamatva. Very important topic, both Ayurvedic and modern. In modern, it is called as immunity. Fighting capacity with the disease. Fighting capacity with the disease. With the bacteria, with the viruses. In the corona, everybody was trying to take Guduchi tablet. Guduchi, Giloya, Tinospora cordifolia. Guduchi Ghanavati is available in the market. That everybody can take whenever there is endemic or epidemic. Guduchi can improve your immunity. That is Vyadhikshamatva. The Ayurvedic word is Vyadhikshamatva. There are two terms of Vyadhikshamatva. Vyadhikshamatvam nama. Vyadhikshamatvam nama. Vyadhi bala virodhitvam. Vyadhi bala virodhitvam. Very important slok. Vyadhikshamatvam nama. Vyadhi bala virodhitvam. Underline Vyadhi bala virodhitvam. Comma. Vyadhi utpadaka pratibandhakatvam. Vyadhi utpadaka pratibandhakatvam. So in Vyadhikshamatva, there are two things. If by chance you are suffering from asthma, psoriasis, hypertension, then I want to control the attacks. That is Vyadhi bala virodhitva. Vyadhi, disease, bala, strength. I want to reduce the potency, strength, intensity of the disease by improving my immunity. Vyadhi bala virodhitva. What is the next? Vyadhi utpadaka pratibandhakatvam. I don't want my lung cancer. I don't want lung cancer. So what I should do? Avoid the smoking. I don't want liver cancer. What to do? No alcohol. So Vyadhi utpadaka pratibandhakatvam. That we do the purification according to season. We have seen Vasanta, spring Rutu, Vamana for Kapha. That is why we take this Vamana in the spring. Vyadhi utpadaka pratibandhakatvam. I don't want any Kapha problem throughout the year. That's why I have taken the Vamana if I am the Kapha Prakriti person. If I am a Pitta Prakriti person, I don't want acidity. I don't want skin problem. I don't want burning. I don't want any bleeding. What to do? Utpadaka pratibandhakatvam. I will take Rakta Mokshana, blood donation in this month, October hit. Sharad Rutu, Pitta Prakop, Virechan and Rakta Mokshan, that is Shodhana. Vata Prakriti person. He don't want to get arthritis, joint pain, Sandhigata Vata. No. What he should do? What is to do? Vyadhikshamatva. Yes. In Varsha Rutu, he must take the Basti treatment. Two types of Basti. Anuvasana, only oil. Asthapana or Niruha. I think you understood now that Dr. Deshpande is using all the terms, every lecture, many, same. But then that is why it is going into the head. Okay. Next, Oja. Oja. What is Oja? Oja, essence. Essence. E-S-S-E-N-C. Essence of all the tissues. The best of Rasadhatu becomes Oja. Best of Raktadhatu becomes Oja. Best of Mausadhatu becomes Oja. So all the dhatu, all the tissues, if you are the best, you can get the best Oja. Oja, O-J-A, is like a substance. But I am very sorry to tell you, till today, nobody can prove that this particular substance is equal to Oj. No. No, nobody can say this particular. Some say sugar is Oj. Some will say oxygen is Oj. No. Better way, like immunity, we should understand this is a complex molecules which can be taken care of our Vyadhikshamatva. So OJ is very important for Vyadhikshamatva. OJ concept in Roga Nidan, very important. You remember Charak Uttarardha? Chikitsasthan, first chapter, Rasayan. You remember Rasayan? By Rasayan, we increase the OJ, remember. And when we get best OJA, your immunity, your Vyadhikshamatva, best. Yes. OJA is responsible for Vyadhikshamatva, immunity. But unfortunately, sometimes there is also pathology in the OJ. Vata, Pitta, Kapha, they are good, but sometimes they are having some problem. Similarly, OJ can have problem like Dosh, OJ, Dushti. Here you can see the words. OJ, Vyapad, OJ, Kshaya, OJ, Vistrans. 3 words are there. OJ, Vistrans. Some complicated. Huh? Vistrans. Ojo, Vyapad. OJ, Kshaya. These are the 3 pathology of OJ. HIV, you know the HIV AIDS. Oh. HIV. Gupta Roga. When any person visits to the social worker, that is sex social worker, Veshagamana, then the person suffers from venereal diseases related with genitals, like syphilis, gonorrhea, and this is dangerous, fatal. Man can die. That is HIV infection or AIDS, AIDS, autoimmune disease syndrome. So, Ojakshaya, Ayurveda, Ojakshaya. Okay, next. Some modern topics are there. Basic pathology, introduction to pathology, cell injury. This total modern. Cell injury, inflammation. I will send you, this video is available on the YouTube, my video. Inflammation. Then next is edema. Edema is a swelling all over the body. Okay. So there are 3 main causes of the edema. I have already told you. Again and again I am telling you. Cardiac edema. Cardiac, because of the heart problem. CCF, congestive cardiac failure. How you will identify? Pedal edema. On the feet. The edema is always on the feet because of the heart problem. If kidney problem, kidney. Renal edema. Renal, RENAL, edema. Here. In the morning, here. Periorbital swelling. Periorbital swelling around the eyes. That is called as a periorbital swelling. In the morning. What is that? Renal edema, kidney problem. And then liver, ascites. Fluid in the peritoneal cavity. That is hepatic edema. So 3 edema are important. Cardiac edema, that is pedal edema. Renal edema, periorbital. Hepatic edema, ascites. Very simple. Huh? Next, types of the immunity. Then here you can see hemorrhage, raktastrava, bleeding, thrombosis, blood clot. Stable blood clot, thrombosis. Moving blood clot, moving embolism. Moving blood clot. Okay, next. Tumor. There are mainly 2 types of tumor. Benign, BENIGN. Benign tumor. Tumor is a गाठ. मराठीमध्ये आम्ही गाठ म्हणतो त्याला. Tumor. And malignant. MALIGNANT. Benign, malignant. Benign means no cancer. And malignant, yes, cancer. So tumor are of 2 types, benign and malignant. We will see how to differentiate. Next is nutritional disorders. From the school we are learning this. This is also there in Swastha Vrutta. This is also in their Stri Rog. This is also in the children diseases. Protein deficiency, carbohydrate deficiency, fat deficiency, vitamin A deficiency, vitamin D deficiency, C deficiency, all deficiencies. Huh? You have to read it very carefully. Infections, bacteria, virus, fungus, what is that? We will see. Part B. Paper 1, we are discussing only paper 1. Nidana Panchak. Most important from the part B. Most important. Write down, please write down. Part A, Srotas, 13 Srotas. You are going to make a homework, 13 Srotasas, causes and symptoms with their meaning from your textbook, whichever you have. Better way, write down in English and very fantastic writing. Send me the photograph, PDF, okay? Part B, Nidana Panchak. I have already mentioned Nidana, Purvarupa, Rupa, Upashaya, Samprapti. 5 things, 5. For diagnostics of the Vyadhi, disease. If I want to diagnose Jwara, if I want to diagnose asthma, any disease, any Atisar, whatever, Pakshaghat, Nidana Panchak is very important. Number 1, Nidana, write down, Hetu, causes. Nidana. Second, Purvarupa, Purva. Before starting the disease, warning signal, I have mentioned, Purvarupa, prodromal symptoms. Before actual starting the disease. For example, if I am getting some problem with the throat, to begin with, I get a little bit irritation is there, sore throat. And in between, there may be pharyngitis after 2 days. There may be pharyngitis after 2 days. So I get little bit irritation, that is a sore, S-O-R-E, throat. Little bit pinching sensation, in between little bit cough. So that can be the beginning of pharyngitis. That is Purvarupa. And when there is Rupa, severe pain in the throat, difficulty in deglutation, lot of cough. That is Rupa. So Nidana, Purvarupa, Rupa. Upashaya and Anupashaya. Upashaya and Anupashaya. Therapeutical test. This is called as a therapeutical test. Suppose here I am suspecting, what is that? Is it a kapha? It is a vata? What is that? I ask the patient to take a cold water, freeze water, eat ice cream. Oh, doctor, what you are saying? Yesterday I took freeze water. My God, I could not sleep at night. That is Anupashaya. Because patient not felt better after drinking cold, after eating ice cream. But next day I asked him, only for the whole day, night you drink warm water. Only warm water. On the next day he comes, doctor, fantastic. I nearly gone, my sore throat has gone, pharyngitis is gone because of the warm water. Warm water drinking, Upashaya, getting relief. Eating ice cream, symptoms are more, Anupashaya, bad effect. Upashaya better, good. Anupashaya bad. I hope you understood. And last word is a Samprapti. Samprapti, pathogenesis. We have these 5 topics. In the next lecture, maybe we are going to take, but these are the must to learn by heart. These are the commonest questions asked in the examination. Either they will ask about describe Nidan, describe Pururup, describe Roop, describe Upashaya, Anupashaya, describe Samprapti, types, definitions, everything they will ask. Very important topic, Nidana Panchak. Roga Vidyan, Vikruti Vidyan, Nidana Panchak is important. So this is a Roga. Can you see my cursor, Roga? What is Rogi? Patient. You have to examine the patient. So there are Trividha Pariksha. You know Trividha? 3. Darshana, Sparshana, Prashna. How you can examine the patient? By Darshana. Looking, just looking. Darshana. Inspection. Inspection, just looking by eyes. How is the patient is walking? Whether he is obese, whether he is thin, whether there is a black coloration, any change in the skin, if he is breathless, only looking. Darshan. Second, sparshan. Sparsha, touch. Touch, I will say abdomen. Okay. Okay, here. Sparshan, touch. Sparshan. First is darshan, inspection. Sparshan, modern words. I am now will tell 3 modern words. 3. Palpation. First is just touching. My shoulder is paining, so I will touch here. Palpation. Okay. Okay. Is there any swelling, tumor? Palpate. This is what I am doing is palpation. Now, especially next is a percussion, especially for the chest and for the abdomen. Here, just see my hand. For whole chest and for abdomen, what I am doing right now is a percussion. Percussion. And examining by the stethoscope, auscultation. Palpation, percussion, auscultation, all 3 are called sparshana in Ayurveda. Sparshana. So darshana first, sparshana second, and third, prashna. Prashna. Interrogation. Asking the questions. Tell me, दादा काय तुमचं नाव आहे? काय होतंय तुम्हाला? अच्छा, खोकला येतोय? Are you getting cough? कधीपासून येतोय? From yesterday, from 5 days, from 8 days? लय दिवस झाले डॉक्टर. So that is maybe 15 days. काय तपासणी वगैरे केली का? Have you done any examination? नाही बा, काय नाही. डॉक्टर काय बोलले नाही आपल्याला. He says that I have not done. So all this is a prashna, interrogation, discussion with the patient and taking the knowledge of the disease. This is Rogi Pariksha, examination of the patient. I am repeatedly telling you, my dear friends, I have the mobile app, free download from the Google Play Store. Sir, what is the name of your app? Same, Ayurveda Academy. You download it, download. There are nearly 12 programs, 12. And one of the important programs for Roga Nidan Vikriti Vijnan, clinical examination. Clinical examination. Fantastic videos. How to examine nervous system, how to examine respiratory system, how to examine cardiovascular system, how to examine ladies for vaginal examination, how to examine the children, how to examine ENT. All videos are there. Yes. So please download it, purchase that program, clinical examination, and next time in between I will ask what video you have seen, what is there, what is that. I am going to ask you. So this is all Rogi Pariksha. Next. Nidana Panchak, Purva Roop, Roop Upashed. I have discussed. Samprapti, you can see. Shatakriya Kal. This is already in the first year BMS. Huh? Yes, Kriya Sharira. Chaya, Prakop, Prasar, Thana Sonshre. Do you remember? Vyakti, Bhed. Chaya, Prakop, Prasar, Sthana Sonshre, Vyakti, Bhed. How many? 6. Shatak Kriya Kal. These are the steps in the pathogenesis. And treatment also can be done in Chayavastha, Prakopavastha, Prasaravastha, etc. This is also important topic for the examination. Shatak Kriya Kal. Next is a Upadrava, complication of the diseases. For example, I have the acidity, I have the peptic ulcer. In the stomach, I have the ulcer. What is the complication? What can be the complication? Yes, bleeding. Bleeding can take place. Lot of bleeding will be there. That is a hemorrhage, raktastrava. That is a complication of peptic ulcer. Next is Udarka. Please write down. Udarka, after effect. Is also a type of complication, but after residual effect of any disease. For example, the patient has suffered from rheumatoid arthritis. More these joints, metacarpopharyngeal. And then there is a problem like this, deformity, permanent deformity, joint deformity because of the rheumatoid arthritis. That is udark, is better not complication. It is udark after residual damage. Residual after damage. Are you getting my point about a disease? Next. Arishta Vidyan. Arishta, bad prognosis. In the Charak Purvardh, there is Indriya Sthana. Indriya Sthana. And there, lot of Arishta Lakshanas are mentioned. For example, if the patient is admitted in the hospital for heart attack and his blood pressure goes down, hypotension, pulse is not palpable, so that is Arishta. Patient may die after some time. That is a bad omen sign. O-M-E-N, my God, omen, danger, fatal. Patient may die. That is Arishta Vidyan. Next word I have used, Sadhya, Sadhyatva. Sadhya and Asadhya. Then Sukha Sadhya, Krichra Sadhya, Yapya, Anupakramya. Curable, non-curable. Curable, again two types. Sukha Sadhya, easily curable. Krichra Sadhya, difficult to cure. Some operation may be needed. Anupakramya, second part. Not curable, but Yapya, diabetes. Whenever the patient is following diet, whenever the patient is taking medicines, it is okay. So that is not curable, that is uncontrollable. Some diseases can be controlled but cannot be cured. No, permanent cure is not possible. And this is a yapya. And another is a pratyakhya. That means absolutely the doctor will not say I am going to cure this disease. For example, cancer, HIV, motor neuron disease, incurable. Are you getting my point? Okay. Then Sadhya Sadhya to finished. 11.12. Anukta Vyadhi. Whichever the Vyadhis, diseases that are not directly mentioned in the Samhita, not directly mentioned, that is Anukta. Ukta means mentioned, and Anukta not mentioned. Okay. Pariksha Vijnana. That here, for example, Darshanadi, Trividha Pariksha, just now fully explained. Darshana, Sparshana, Prashna. You start making the notes now. You start making the notes. Chaturvidha Pariksha. Darshana, Sparshana, Prashna, and Anumana. Anuman, logical thinking. Shadvidha Pariksha. There are different types of the examination method. We are going to discuss all these things afterwards. Dashavidha Pariksha. Dusham, Desham, Balam, Kalam. Dusham, Desham, Balam, Kalam. Analam, Prakrutim, Vayaha, Satvam, Satmyam, Avasthascha, Pruthak Vidaha. This is important shlok about the Dashavidha Pariksha. Dusha, Desh, Bala, Kala, Dusham, Desham, Balam, Kala, Anala, Agni, Prakruti, Vayaha, Sattva, Satmya, Avasthascha, Pruthak Vidaha. In this way, you have to examine about the patient also. Dashavidha Pariksha importance, basic knowledge of electrocardiogram, ECG. Again, folding my hands and request to all viewers, Professor Deshpande, mobile app, what is the name? Ayurveda Academy. Download free from Google Play Store. But interesting webinar. Interesting webinar. ECG interpretation. Superb. Slides, explanation, simple language. Only 1 or 2 hours you spend. But if you purchase only 200 rupees, lifelong you can study. As many times as you want, wherever you want, in the clinic, here and there, you just open it. Okay, myocardial infarction. What to see? See in the ECG. Left ventricular hypertrophy, LVH. How to diagnose? Right ventricular hypertrophy. How to diagnose? Calcium deficiency. How to diagnose? Potassium less. Even whenever you meet to any doctors, any clinic, any hospital, please tell them these important 2 programs of the Deshpande's app, mobile app. Everybody make a propaganda like this. Hello. परचेस दिस ECG वेबिनार, वेरी लेस, मामूली कीमत है भैया उसकी, ठीक है, आगे चलते हैं. नाउ दिस इज द एंड ऑफ पेपर 1. So my dear friend, I will just not, lecture is not finished, just I will take a stop this sharing and I will open another, or I can directly open here. Okay, I will go there like this. Yes, paper 1 is in front of you. Are you getting? Now we will try to fast read some questions. We have understood the syllabus. Now let us see what has in the paper 1. Very quick. Now we have the nearly 10 minutes in our hand. Okay, we will go fast. Define vyadhi. What is vyadhi? Dosha dushya sammurchana janito vyadhi. Right, its classification. Sharik vyadhi, manasik vyadhi. Explain vyadhi ghatak. I will explain. Write down vyadhi ghatak in your notebook. Vyadhi ghatak question mark. Define hetu, nidan, synonyms, paryay now, classification of the hetu. Write a note on dosha gati and roga marga, abhyantara marga, bahya marga. I have explained you. Cell injury, modern pathology, cellular adaptation. Write a note on sama dosha lakshana, samavad, niramavat, samapitta, niramapitta, samakafa, niram. You write down. Start own study, self study. Write it down notebook from your textbook. Shlok meaning. Make a PDF, send to Professor Deshpande. He will say, okay, good. Come on, do it. Because simultaneously with my lectures, everybody must study of their own also. Little bit spoon feeding is okay, but how many time we have? We don't have much time. Dr. Deshpande is also busy all the time, so you have to do your own homework. Samadosh, Niramadosh, you have to write down. Define srotas. Write annava srotas, dushti, karana and lakshana. Just now I have mentioned at least one srotas from the 13 srotasas. In the ladies, there are two more. In the ladies, stanyavaha srotas and artavavaha srotas. Don't forget, in the female. So from 13 srotasas, in your internal examination, in your external examination, there must be one question. Nidan Panchak, must one question. Either they will ask Nidan, Hetu, Roop, Upashay, Purorup, something will be asked. At least one Srotasa will be asked for LAQ. Don't forget it. Okay, we will go. Nadi Pariksha, pulse examination modern. In that video, my clinical examination, best. You will never forget that pulse examination if you see one or twice. Nadi Pariksha according to Ayurveda also. Dhruta Gati, Manda Gati, etc. Sama Nadi, Nirama Nadi. I am going to explain you. Then explain Rupa and write down the synonyms. Write in it about Shadavidha Pariksha. Shadvidha Pariksha, Panchabhotik and another thing. Define Samprapti, just no pathogenesis. Explain the Sankhya and the Vidhi Samprapti. These are the types of the Samprapti. Classification and Lakshana of Sadhya Sadhyatva. Just now we have talked. Okay. Indriya Pradoshaja Vikar. Jnanendriya and Karmendriya. Shrotra, Tvak, Chakshu, Rasana, Gran. Jnanendriya. Vak, Pani, Pad, Payu, Upasth, Karmendriya, sensory organs, motor organs. What are the problems can be happen with these? Vikara means diseases. Then Ashraya Shri Bhav. Just now I have mentioned. Rakta Vriddhi Lakshana. All Vriddhi Kshaya. Write down, start writing the shlokas. Own study is important in Roga Nidan. Subject is vast. Agni Dushti Hetu, digestive fire. Then Nidanarthakara Rog. One disease can be a cause for the another disease. Nidanarthakara Rog. From the obesity, the patient can get diabetes. From the obesity, the patient can get the heart problem. So obesity is a cause of another disease. Okay, this is a cycle. This is like a cycle. Define Arishta, bad omen, bad signs. Write the importance of Dashavidha Pariksha, advantage of ultrasonography. Mala Pariksha, Sam and Niram, stool examination. Amoebiasis, giardiasis, black stool, whether blood is there. Then Pariksha, how to do the Pariksha. Next. Rakta Vriddhi Lakshana, Mala Pradoshaja Vikara, Koshtagati. This is a new concept. Koshtagati and Shakhagati. Please write down. Koshtagati, Shakhagati. whenever the doshas are coming at a proper time in a proper place and proper functioning, that is dosha gati, koshtha gati, I'm sorry, from the external structure to the lumen, and from lumen to the walls of the structure, walls of the organ, from the lumen, hollow part, if they are going to the wall, that is shakhagati. Koshtagati inside the lumen, shakhagati out from lumen to outside, to periphery, to the outer lining. Are you getting a rough idea? Rough idea? Okay. Ashto Mahagada, I have discussed. Atidirgha, Atikrisha, Aloma, Atiloma, Atistula, Atikrisha, Atigaura, Ati Shava. Okay. Arishta Prakara, Sannikrishta Hetu. These are the types of the Hetu or the causes. Sannikrishta, very close. Viprakrishta, little bit on the what you can say, the distance, having not intimate relation with the effect. Doshapak, Dhatupak. Remember, Doshapak is good, Dhatupak is bad. Sushrutokta Saptavidha Vyadhi, then thrombosis, embolism, Samprapti. You can see just Samprapti, Upashaya, we have discussed. Inflammation, Vyadhikshamatva, Astiva Srotas. Can you see? Dushti Hetu, Lakshana, Sandhi Parikshan. Sir, where I can get Sandhi Parikshan? Yes, my app, mobile app, clinical examination. Then Rupa Vyakhya, about the Rupa. Lakshana. Rupa is a Lakshan, symptoms and signs. Ama Vyakhya, Swarup Lakshan, Atura Bali Parikshanartha, Charakopta, Dashavidha Pariksha. Okay. Vata Prakop Lakshan, Samprapti Vyakhya, Indriya Pradosha, same and same. Arishta, vitamin D, nutritional disorders. Yes, you remember? Osteopenia, osteoporosis, rickets, phakka, balrog. Remember balrog? Vitamin D deficiency. Sun rays, ultraviolet rays, vitamin D, good. Vitamin D is necessary for calcium absorption from the intestine. Ashto Mahagada, Atidirgha Atirasu, Amlapitta, acidity. Any diseases will be asked, any disease. Hetu, Prakar, Lakshana, Tamakashwas, but you make a list which are the common diseases they have asked. And accordingly, we will concentrate, focus on those diseases first and then remaining. Okay, we are not going to study beginning all the diseases. Only the which I have already asked many times. Tamakashwas, bronchial asthma, Udarashul, pain in abdomen, Apasmar and Unmad. Apasmar is epilepsy, physical problem, and Unmad, psychological problem, hysteria. Rajakshma, like a tuberculosis, Amavat, like a rheumatic fever or rheumatoid, Kamala Vyadhi, jaundice, Amavat, again Nidan Panchak, Prameha Vyadhi, urinary problems, Vimshanti Prameha, 20 types. Madhumeha is one of the type, diabetes mellitus. Atisar, loose motions, Grahani Rog, irritable bowel syndrome. We will go a little bit fast. Koshtatun Shakhagaman, write the causes of dosha from Koshta to Shakha. Koshta to Shakha, like this. Write Ama definition and Lakshana. Shock. Less blood supply to the brain. Sadhya Sadhyatva, Pitta Prakop Lakshan. Next, explain the difference between natural and artificial immunity. Difference between Vyadhi and Lakshana. Cell injury, cell adaptation. Then Saptavidha Vyadhi, Ashtavidha Pariksha, Nadi, Mutram, Malam, Jivva, Shabda, Sparsha, Drik Akruti, Yogaratnakar. Ashtavidha Pariksha, Nadi, Mutram, Malam, Jivva, Shabda, Sparsha, Drik Akruti. CT scan, MRI, Arishta, Raktavasrotas, Mulasthan, Dushti Hetu, then Shatakriyakal, Vyadhikshamatva, Samprapti. Just Dr. Deshpande is giving you the Majjavasrotas, Mulasthan, Dushti Hetu, Dushti Lakshan. This is assignment for you. Okay. Next, Pitta Vruddhi Lakshan, Sama Mala Lakshan, Hetu Sankar. What is Hetu Sankar? 2 or 3 diseases together. Hetu Sankar. Madhyam Marga, like a brain and vital organs. Madhyam Marga Vyadhi, Udarak, tip, Mausavasrotas, Dushti Lakshana, Jivha Parikshan, tongue examination, Sadhya Sadhyatva, Raktavasrotas, Dushti Hetu Lakshan, ECG, Dr. Deshpande's mobile app program, ECG interpretation, thrombosis, vitamin C deficiency, scurvy, bleeding from the gum, ischemia and infarction difference, Ama Vyakhya Hetu Samanya Lakshan, Annavasrutas, Samprapti, Ashtavidha Pariksha, Nadi Mutram Malam Jivva, पित्त प्रकोप लक्षण, धातुपाक बॅड, दोषपाक गुड, रोगमार्ग अभ्यंतर बाह्य अँड मध्यम मार्ग, निदानार्थकर व्याधी, सक्रिय अँड निष्क्रिय ऍक्टिव्ह अँड पॅसिव्ह इम्युनिटी, हायपरसेन्सिटिव्हिटी, देन मायक्रोऑर्गॅनिझम, ओज व्याख्या, व्याधी अवस्था, ट्यूमर, बिनाइन, मॅलिग्नंट, स्रोतोदृष्टी, ख वैगुण्य मीन्स स्रोतोवैगुण्य. लॉट ऑफ डिस्कशन आय हॅव मेड इन द बिगिनिंग. थ्रोम्बोसिस, संप्राप्ती, दशविध परीक्षा, अरिष्ट लक्षण, षटक्रियाकाल, उपधातू प्रदोषज विकार. यू मस्ट नो व्हॉट इज द उपधातू. रसाचे उपधातू कोण आहेत, रक्ताचे उपधातू कोण आहे. मेक अ टेबल टुडे ओनली. धातू, उपधातू अँड मल. यू मेक टेबल. ओके. दोष आश्रयाश्रय संबंध, लाईक रक्त अँड पित्त आश्रयाश्रय, वात अँड अस्थि आश्रयाश्रय, अँड कफ अँड ऑल अदर धातूज. विकल्प संप्राप्ती, जीवनसत्व सी, आशयापकर्ष गती, मध्यम मार्ग, दोषपाक गुड, धातुपाक बॅड. रक्त व स्रोतस, इस्टिमिया इन्फार्क्शन, ओजोदृष्टी, ईसीजी, स्रोतोदृष्टी, जीवाणू अँड विषाणू डिफरन्स, बॅक्टेरिया अँड व्हायरस, द डिफरन्स इन बॅक्टेरिया अँड व्हायरस, व्याधी क्षमत्व, उपशय अनुपशय, निदान पंचक, निदान पुरुरूप रूप उपशय संप्राप्ती. ओके. अष्टविध परीक्षा, संचय अवस्थेतील दोष लक्षण, साम कफ लक्षण, रसव स्रोतस दृष्टी हेतू अँड लक्षण. जस्ट ए मोमेंट, यू हॅव सेड समथिंग. Sir, your voice. Okay, I will check what has happened. No, my voice is there. Aniket, my voice is there. Huh? You will get it in the video. Don't worry, be happy. Only last 2 minutes. We will finish. Rasava Srotas Dृष्टी Hetu, Sannikrishta and Viprakrishta, then ZN staining. This is typical pathological laboratory work. Ama Vyakhya, Sukha Sadhya and Kashta Sadhya Vyadhi, Thromboembolism, शुक्र व स्रोत दृष्टी हेतू दृष्टी लक्षण, इन्फ्लमेशन, पुरुरूप व्याख्या, एडिमा, उपद्रव, षटक्रियाकाल, प्राण व स्रोतस, आकोटन परीक्षा, पर्कशन, व्याधीची व्याख्या, द्विविध त्रिविध सप्तविध प्रकार, दोषपाक लक्षण, सामपित्त लक्षण, कोथ, गँग्रीन, ख वैगुण्य, व्याधी घटक, निदानार्थकर व्याधी, षटक्रियाकाल, मज्जा व स्रोतस दृष्टी हेतू लक्षण, व्याधी क्षमत्व, हेतू प्रकार, अष्टो निंदित पुरुष, इश्चिमिया, साध्यासाध्यत्व, निदान पंचक, अष्टविध परीक्षा, दोषगती, कुपोषणजन्य विकार, न्यूट्रिशनल डिसऑर्डर्स, आम व्याख्या, दोषपाक इज गुड, व्याधी धातुपाक इज बॅड, व्याधी संकर, वातवृद्धी, थ्रोम्बोसिस, उपद्रव उदरक, रस व स्रोत दृष्टी हेतू लक्षण, निदान पंचक, षटक्रियाकाल, षडविध परीक्षा, संप्राप्ती, कर्कटार्बुद, मॅलिग्नंट ट्यूमर, कर्कटार्बुद, ओज दृष्टीचे प्रकार, हायपरसेन्सिटिव्हिटी, हेतू डिटेल, निदान पंचक हेतू, रक्त व स्रोतस मूलस्थान, व्याधी क्षमत्व. I am sorry, I am little bit fast, but just I will send you this PDF. Don't worry, be happy. Don't worry, be happy. I will send you this PDF. Every questions that bank, I am going to send you. Every subject. Very shortly on the mail. Always you check the mail. Our communication will be through the mail also. Then download it, make a folder, keep it over there. Professor Deshpande's class. Keep all the matter, whichever Dr. Deshpande is sending. Okay, one folder. But my dear friend, always that folder should have the backup on the Google Drive. Learn how to upload on the Google Drive. Don't keep only on the mobile. Don't keep only on the laptop or the desktop. No. If your laptop is crash, if your desktop is crash, if you make a factory setting of your mobile, everything will be lost. So my dear friends, that folder, every after week, you must upload on the Google Drive. Don't forget this. Doshagati, Arbut, Pitta Prakop, Rakta Pradoshaja Vikar. Okay. Srotasa, Trivida Pariksha, explain the Bija Dushti, Genesis, Genomics, chromosome, hereditary diseases. Ashraya Shri Sambandha, ZN staining, Kafudosh Vruddhikshe, Dashavida Pariksha, उपशय, आम, सामपित्त, ओजोदृष्टी, अष्टो महागत, आम संकल्पना, जीवाणु विषाणु डिफरन्स, ईसीजी, अष्टविध परीक्षा. I think everything has been cleared up. So my dear friends, today it is 8:02, 8 o'clock and 2 minutes. Okay, my dear friends, this is the end of today's lecture on Roga Nidan Vikriti Vigyan. Lecture first is there. We have discussed the syllabus point. We have discussed the paper 1 only. Please write down paper 1 only. Clearly paper 1 only. And that lecture is taken on 9th of October 2023 from 7 to 8.02. Okay. Thank you very much for your nice support. We will meet tomorrow for the Stri Roga Prasuti Tantra Vidyan. Okay. Paper 1, some points we will discuss as an answer, question answers. Okay. Thank you very much and take care. Bye-bye.